with plastic surgeon to the stars, JJ Staiano. That's right, yours truly. I'm here. I'm doing the login for the Instagram because I'm multi-channel, live Q&A with plastic surgeon. I'm multi-channel, so I'm doing that now as we speak. Prepare your questions because it's going to be a big one tonight. I can promise you that. It's going to be a big one. Yes, we're locked down. Actually, there's no lockdown questions. I've got something to say. Well, actually, there is some sort of lockdown question. So I've got stuff to say about where we're at. Right, there we go. Go live. How do I go? I know how to go live. Come on. So if you've got questions, please ask them. But if you haven't got questions, do not worry. Do not worry. Because I've got some, so I'm going to crack on. You know what I mean? I'm just going to get on with it because that's how I roll. You know, taking care of business, right? And I did get some questions on Instagram, didn't I? Now it's not on that. It's okay. I made a note of them. Right. Now, question number one. Oh, hold on a minute. Hold on. We've got a question on Instagram straight in. How do I know BBL has necrosis? So that's a bit of an alarming question, Melanin. Melanin's asked on Instagram, how do I know BBL? So BBL, Brazilian butt lift. So Brazilian butt lift is traditionally fat grafting to the buttock. So if you're talking about necrosis, can I just say, I'm assuming everything's working. Is that a fair assumption? Yeah, we'll just crack on. If you're talking about a necrosis, then there's skin necrosis is one thing, and you'd know about skin necrosis because the skin would go black or at least mottled. Got a question about that here actually, but yeah, hardening. So what you're talking about there, Melanin, is actually fat necrosis. So fat necrosis is more common with fat grafting. So a Brazilian butt lift is usually fat grafting, so fat injected into the buttock. And one of the risks of injecting fat into places is it has to take like a graft, and if it doesn't take, it dies and forms a hard lump. So if you have got hard lumps, Melanin, then that sounds like it may well be fat necrosis. And what I would normally say I don't do Brazilian butt lift, so just to disclose myself on Brazilian butt lift, but in general terms of fat necrosis after fat grafting, so I do quite a lot of fat grafting. You've got to be a bit careful with fat grafting because obviously if you inject too much, you get necrosis, and if you inject too little, you get subtle results. So I'm more on the subtle results side than the high volume side, but buttocks you often need to do high volumes. So what I would normally say, if you're worried about necrosis, then it's basically scar tissue of the fat. So you would wait to see if the scar tissue softened. So if you have got hardening, then I would wait to see if it's softened. I would advise you to massage it and wait to see if it's softened and give it some time. Minimum 3 months, ideally 6 to 12 months, really, for waiting it to soften. And if it doesn't soften, if you still have fat necrosis and hard lumps, you can remove those hard lumps surgically. It would mean a scar, but sometimes most of the work that I do is breast. So if you do fat grafting to the breast and get some fat necrosis, if it doesn't soften and settle over time, you can remove those hard lumps. But give it time is my answer to that, Melanin. Khan says all is good. Khan, long time no see. How are you? And I'm glad that all is good. Or do you mean all is good with the sound? Maybe you mean all is good with the sound. But anyway, either way, glad to see you. Hold on a minute. Fat necrosis, Melanin. If you leave in the fat necrosis, is it dangerous? No, Melanin, it is not. So the only thing I would preface that is to say most of the work I do is breast. So if someone has a hard lump in the breast, we might think, hold on a minute, is that fat? We just better check and biopsy it. Buttock, obviously, you're not worried about lumps in the buttock. You know, breast could be a sort of breast cancer that you're calling fat necrosis. But so if you had some fat necrosis in the breast, you might be concerned. But fat necrosis in itself is nothing to worry about, and is not dangerous, and you don't have to worry about, and you don't have to do anything about it. It is just uncomfortable, and it can be unsightly. So you may want to have something removed, but that is not dangerous in itself, Melanin. That is not why people come to harm with Brazilian butt lift. It is not fat necrosis that causes the problems. It's fat being injected into the vessels that then goes around your body, causes blockages in your lungs and things like that. So if there's been some fat that's died and caused a hard lump in your buttock, totally not dangerous. Massage it, stick with your surgeon as always, talk to your surgeon about it, but yeah, it's not in itself anything to worry about. What we got here on Facebook, we've got Jojo. I've been investigated for Ehlers-Danlos syndrome as I have weak connective tissue. I have a diastasis recti and an umbilical hernia and really want a tummy tuck. Would you still operate in these circumstances? Two parts to that question, Jojo. First part is at the moment. Second part is ever. At the moment, and this goes on with Jay's question, are you doing surgery at the moment? So in answer to the sort of general term, are we doing surgery in the moment? Then the answer is yes, we are. But we are very aware of what is going on in the world and in the country and in the NHS mainly, and what we've sort of all got together in terms of the sort of plastic surgeons, particularly ones who own clinics and things. And it's been, we don't want to put any pressure on the NHS. So we are still seeing people, we are still treating people. We don't want to put any pressure on the NHS. So for that reason, we're not doing anything that might remotely need to have any help from the NHS, any sort of inter-hospital transfer, and God help us, any ITU care. So that means operating on people who are what's called ASA 1, which is ASA is like an anesthetic grade of how if you've got any medical problems, basically. So ideally, people without medical problems, really. So that any sort of medical problem would be. We'd be thinking, oh God, if there's any risk that this is not straightforward, I think we'd be saying to you, look, at the moment, things are pretty sketchy at the NHS. So let's, can we just do it later on, sort of thing, when things are better? So at the moment, I think things might be a bit sketchy. In general terms, though, Jojo, operating on someone with Ehlers-Danlos is possible, but you would have to have a proper consultation, because the thing about Ehlers-Danlos is your skin is hyperelastic, as you say, weak connective tissue, and so so there is a risk of wound healing problems. And one of the things with the tummy tuck is concerns in terms of wound healing and what have you. So you are increasing your risks in those terms. So it's not that you couldn't have a tummy tuck, but it's just that you would have an increased risk of wound healing problems. So that's so it's a yes, but it's a yes, but possibly not at the moment. UC Biodol, my fave. How do you pronounce FAV? Fave. It's got an E on it, doesn't it? But anyway, Blue Trolley Dolly's in the house. Are you doing surgery at the moment? No. When will you be back operating? And this would be my third breast augmentation. How can I ensure I will the result I require this time? What should I be asking for? I don't know, Teresa. What should you be asking for? I don't know. What do you want? I've got to be honest with you, Teresa. It is a bit like the law of diminishing returns with surgery in general, particularly sort of breast implant surgery. The problem with breast implant surgery is you get scar tissue around the implant, which causes what's called a capsular contracture, which is hardening around the implant. And every time you do surgery, you get more scar tissue. So I've got to be honest with you, Teresa. We try and minimize the amount of operations. So you're saying it's my third one, and I want to be sure I get the result I want. I'd be saying to you, it's your third one. You're probably going to get a worse result every time, Teresa. It's horrible to say, unless you've had a specific problem after one of them, or they're not placed right, and you might be able to place them better. But I guess it depends on why you're having why you're having 3 operations. But in general terms, more operations is not good, Teresa, and you want to sort of minimize your surgeries to the breast. And how can I ensure I get the result? Well, I've got to be honest with you, Teresa. Good God, I wish I could ensure that you would. I mean, I don't know if I'm your surgeon, but whoever your surgeon is, we wish we could ensure you get the result you want. We wish we could say to you, yes, you're going to get the result. bottom line, Teresa, you can't ensure you're going to get the result you want. You can just do your best to make sure you've explained your goals and your wishes to your surgeon. Perhaps looked at some results, maybe spoken to some other patients of your surgeon, and thought that you might have a good chance of getting a good outcome. Sounds awful, that, doesn't it? But I mean, obviously we hope everybody gets a good outcome, but if someone says, how can I ensure I get a good outcome, there's no answer to that. If there was an answer, we'd all do it, wouldn't we? We'd all go into surgery and say, right, I'm going to do what he said to make sure I get a good outcome. You know, every patient wants a good outcome, every surgeon wants a good outcome, but I think it's about making sure you can talk to your surgeon, making sure you've got time to making sure you've got time to discuss your outcomes and what you want, and feeling comfortable that that's a realistic goal, that you've got realistic goals. And that's the name of the game, Teresa. Realistic goals, realistic expectations. That is the name of the game. So hopefully making sure your expectations align with your surgeons, and that is probably your best hope of getting a good result. And positivity, you've got a positive thinking. I don't know if that's the answer you wanted, Teresa, but Jane, your jumper matches your beard. It looks weird. Does my jumper match my beard? That's embarrassing, isn't it? It's embarrassing. What's going on here? I'm not touching my boobs at all, because people never satisfied with the results. You go, UC Biodoll. I'm not sure I would completely endorse that comment, UC Biodoll, since I do a lot of boob surgery. But if that's, you go, sister. Absolutely. Empower yourself. Sorrel Island, I have VA surgery booked in with Mr. Khan through your clinic, and I'm so excited, as am I, Sorrel, as am I. Very excited, and good luck with that. He'll look after you. Danny, would you ever put an implant in while doing breast reduction to ensure desired shape? Good question, Danny. No. Not my thing. People do it. People do breast reduction and then put an implant in to give fullness in the upper pole, because when you do a breast reduction, the fullness is up here and then it settles, and you don't get sustained fullness. So if you want that full look, then an implant does give you that full look. But if you want to be smaller and the full look, it's a bit counterintuitive. So some people over reduce and use an implant to give the full look. I don't like that technique, Danny, and it's not really something that I like doing, because I don't like taking out healthy natural breast tissue and replacing it with an implant, because an implant could have problems in the future. So I don't. Oh, I should take that off. I don't like that technique, but it is a technique, and some people do. So it's a thing. Didn't notice the beard and jumper. He's living the dream, in it. Yeah. Oh my God, what's going on? Got emoji central. How, God, what? Oh, sorry, Facebook. I can see Facebook. I'm just going to do one more Instagram question, then I'll go to Facebook. How long after surgery are you safe to fly? Guess the job from the Instagram name. Blue Trolley Dolly. Blue Trolley Dolly. I'll guess Trolley Dolly. Well, it could be British Rail, couldn't it? You have trolley dollies in British Rail, don't you? Anyway, how long after surgery are you safe to fly? The answer to that, Blue Trolley Dolly, the easy answer to that is 6 weeks. I'll be told I rambled a bit, so shall I just say that, 6 weeks? I'll just say that, 6 weeks. But if you want me to ramble a bit, the rambling answer is that if you have to fly, you can fly. You're not going to be stopped at the airport if you had surgery last week, but it's going to be uncomfortable, it's going to be swollen, and you might need some... you might get some wound healing problems. So you really want to make sure you haven't got any wound healing problems and everything's settled before you fly. And around 6 weeks, things will start to be settled. They'll probably still be a bit swollen, they'll still be a bit uncomfortable. So if you're going on holiday, you might want to leave it a bit longer. But if you're doing work, you might possibly be able to go sooner, as long as you're not doing anything too heavy, because you want to avoid anything too heavy for 4 to 6 weeks after surgery. Right, I am going to go, because this is kicked off now. Facebook. Are you doing surgery? When you be operating? Oh, done that one. How can I have a consultation, please? Jay, you can have a consultation by all means. Message me, and we'll sort it out. Message me and give us your phone number, or just say what day or something. just message or ring 0121 454 3680. They're not there at the moment, but that's the number. Michelle says hi. Hi, Michelle. Long time no see, Michelle. Where you been? You can come back if you've got any problems, or even if you haven't got problems. You're always welcome, Michelle. It'd be lovely to see you, just to see how things are going. Now, Liz has used the appropriate hashtag there, everybody. Liz, hashtag AskJJ. We are not going to get this trending if we don't. Do you do trending on Facebook? Or is that just Twitter? Does trending exist? Anyway, we're not going to get this to be famous if we don't all embrace it, people. So, Liz, well done for getting the hashtag in there. Does everyone who has a tummy tuck find the unnumbing parts across their scar is possible to retain that feeling? So no, not everybody finds their numb in parts. Early on, I would say, Liz, it is very common to have numbness around the scar, between the scar and the belly button, over the skin, feels weird. So it is very common to have numbness early on, but it does not. It is not a definite that you're going to have permanent numbness. But having said that, it can take 9 to 12 months to come back to life. So it does take a long time for nerves to recover. So, I don't know how long ago your tummy tuck was, if indeed you have had a tummy tuck, but then it can take a while for it to come back. Nick, hi there. Can you do a full tummy tuck, gynecomastia surgery and fat transfer on the pecs? Hashtag AskJJ. Bring it on, Nick. Yes, it can be done. I don't do fat transfer to the pecs, Nick. That's not really my thing. I don't do fat transfer for the pecs. I do full tummy tuck and gynecomastia. Again, at the moment, we wouldn't do that. We are not doing combined procedures at the moment because of coronavirus being gone off the scale and gone mental, and so we're only doing straightforward cases, if you like. But in hopefully in a few months things will get better, and certainly that would be a reasonable combination to do, although quite a lot to do, I've got to be honest. And I would find it a little bit counterintuitive having gynecomastia surgery, which is removing fat and glandular tissue from the pecs, if you like, and then doing fat transfer on the pecs. I think that would be counterintuitive, so I wouldn't do that. Gynecomastia and tummy tuck, yes, but to only take the fat off and then inject fat back in sounds not quite right to me, but that's just me. Who am I to say? Claudio Staiano is in the house. Ciao, Claudio. When did you give that message? Are you still here? Sorry, I've been a bit late. Ciao, Claudio. Come stai? Hey? Tutti a posto? Tutti a posto. How are you, Claudio? Claudio is my cousin, everyone. Claudio, lovely to see you here. And I hope everything is okay over there. I hope you're surviving lockdown on the island of Capri. Huh? Living the dream. No, we're locked down in Birmingham. Are you even locked down? Is Capri locked down? Anyway, lovely to see you, Claudio. Lovely to see you. Give my love to everyone who knows me. Give my love to the family. I will tell Dad that you said hello. Michelle Whittaker, do we have to replace our implants after a period of time? I can't remember what you said. Michelle, come back to clinic and we'll have a rap about it. But the answer is no, you don't have to replace your implants after a certain period of time. A lot of people think you need to replace your implants. God, this has gone mental. Replace your implants after a certain period of time, but you don't. However, they can go hard after a certain period of time, which I normally say is 5 or 10 years. And if they go hard, you might want to have them replaced. So you don't have to have them replaced, but after around 5 or 10 years, they might go hard and you might want to have them replaced. So basically, Michelle, if they're not hard, no, you don't have to have them replaced. If they're hard, you might have them replaced. So having said you're welcome to come back to clinic, which you are, and I offer everybody a yearly follow-up and say, look, come back anytime if you've got any questions or concerns. Actually, if you haven't got any concerns, if you're happy with them, that's fine. You don't have to come back to clinic. If you need them replaced, you'll know about it, sort of thing. I'm not going to tell you, I'm not going to find something and tell you need to have them replaced. It will be driven by you because it will be hard and uncomfortable. And actually, the longer you leave them, the better, actually, when that happens. If that happens, let's hope it doesn't. Let's see what's going on Instagram, because this is... I've always joked about being an influencer. I feel like this is what it's like being an influencer, I'm sure. Can you do a tummy tuck, lipo, and breast lift at the same time with a BMI 28? UC by O'Doll, yes. In a normal world, yes, you can do a tummy tuck, lipo, and breast lift at the same time. Perfectly reasonable, perfectly normal combination. In this world as it stands today, no, we are not doing combined procedures at the moment. We're not doing procedures on anyone who would remotely need any sort of intervention from the health service. So we're trying to keep it to smaller procedures, single procedures, not joint procedures, and single procedures which are less than 3 hours, ideally. 3-4 hours is a sort of cut-off. So that would not be a goer at this present time, but in, a month, 3 months, 6 months, I don't know, once the world stabilizes, please, then, under normal circs, that would be reasonable UC by O'Doll. I'm an air hostess, that's why I asked. There you go, Blue Trolley Dolly. Thanks so much. Thank you for asking. Hashtag Ask JJ. Sorry I'm late. It's my birthday. Jackie Crimes is the star Instagram viewer. I know you're always here. Jackie, go and put your feet up. What are you doing watching this guy ramble on your birthday? For goodness sake, go and, what time is it? 7:27. Really, Channel 17, Antiques Road Trip. I'm not going to be there in a minute, so get yourself over there. Come on, live the dream. All these people waving back. How long should it take you to wear a farja after tummy tuck and liposuction? Did someone else? Have I seen this? I've seen this somewhere about a farja. Well, I mean, what's a farja? I'm sorry. What is it? Someone said it was a. Is it a? I'm sorry. I don't know what a farja is. Someone said it was a binder or some kind of garment. As a general rule, UC by O'Doll, I'm going to say 6 weeks, because 6 weeks is when things sort of starting to settle. 6 weeks to 3 months, but yeah, I'm not sure what farja is, I'm afraid. Oh God, what have I done? Body corset. Okay, yeah, 6 weeks. I would say maybe you can start wearing it, but it might hurt. It might be uncomfortable because you might still be a bit swollen a bit. So I would say you can start doing things like wearing stuff like that and being a bit more active at 6 weeks. Well, body corset. I mean, if it's a sort of body corset, I mean, we give you a sort of corset thing after the surgery, so it might be helpful straight away. But I'm not sure what it is. But if it's going to be potentially a bit uncomfortable, I would say 6 weeks you can start seeing how it feels. Beverly Stretch. Hello, Sue. Good to see you. Beverly Stretch asks, I had a reduction and uplift. I'm 6 weeks post-op, but the nipples seem to be in the same position as they were previously. Will this change, do you think? Not really, no. No, I don't think they will, Beverly. I'll be a bit worried about that, Beverly. I mean, what do you mean in the same position they were post-op? We measure it from the sternal notch to there, and it should be sort of shorter. But what I would say to you, Beverly, is that 6 weeks is early days, and it does take a while for things to settle. So I would say minimum 3 months to let things settle. But it's a bit of a thing. I think you need to talk to your surgeon, Beverly. If I'm your surgeon, talk to me. But if not, talk to your surgeon. I know you are talking to me, but talk to me in the clinic, sort of thing. No, I don't think that sounds great. Sue Groves has sent a request. I don't think you meant that, did you, Sue? Most people don't. I think straight away don't know the term you use. Yeah. Yeah, good luck with that, Beverly. Hopefully that'll settle. Hashtag Ask JJ. Thank you very much, Liz. I had an umbilical hernia. I had an umbilical hernia repair with my last 2 pregnancies around 7 years ago, which were pushed back in every time they popped out. Does this mean they'll still be there when I have a tummy tuck? Would it increase chance of complications or make the tummy tuck procedure more risky? No, it probably will mean that they'll still be there with the tummy tuck. And if it's just a small one, then it could be repaired. But if it only comes out when you're having pregnancies, it's obviously not a significant hernia. Does it increase your risk of complications? I suppose marginally, Liz. If we know you've got a hernia there, and sometimes we can demonstrate the hernia by making you increase your abdominal pressure. Like when we test your muscles, lifting your head and shoulders off the bed, or lifting your straight leg raise, lifting both legs off. If you feel around your belly button and tense those muscles, you might be able to feel that defect. So sometimes you can clinically feel the defect. So if you know you've got a defect there, then does it make it more risky? I guess potentially a little bit if you're repairing a hernia because you're putting stitches in the abdominal wall, but not significantly. Don't know. What's your opinion on BII? BII, this is Rosalina on Instagram, BII, breast implant illness. I'm assuming that is what you mean. My opinion on breast implant illness is that it seems to be a thing. And there are definitely people out there who have symptoms. So what breast implant illness is? People with silicone implants who feel unwell in some way and feel it's related to their implants, and then you remove the implants and they feel better. Now, from a medical point of view, there's no evidence to say that silicone implants can make you feel unwell. The symptoms are often non-specific, like tiredness, brain fog, lethargy, hair loss, skin rashes, joint pains. And, if someone comes to this, they say, look, we can't guarantee it's due to your implants because we haven't got any evidence to say that silicone implants can cause these symptoms. However, when you remove the implants, they feel better straight away. And I have seen that happen. I have seen people who have these symptoms, and you remove the implants and they say, oh my God, I feel so much better. I feel great. So it is a thing. That is my opinion on it. However, I don't see it very often. I use a lot of breast implants and I don't see it very often. And I do think that people who suffer from it are quite vocal in the social media world. So it may be that it seems to be very common if you sort of go searching for it. Certainly in my life and in my practice, I don't see it very often. But having said that, I have seen it and it seems to be a thing. Do you get many patients who get their implants explanted? So in my own patients, I have never seen a patient with breast implant illness. I have treated patients with breast implant illness who've had surgery elsewhere. I don't think it's surgeon dependent, but it's just saying it's clearly not that common. But yes, I have seen people who've had their implants explanted. As I say, I have seen people with breast implant illness. The main thing, I guess, for explantation is capsular contracture. That would be the main concern. And I did have one patient who had pain, persistent pain, which I think there's a question here on it about, who had the implants explanted. And again, I couldn't guarantee that will make the pain better because it's very uncommon for implants to cause pain. Long term, short term, yes, but long term, no. So I'm like, I can't guarantee this will get better. But she was adamant, and I removed the implants, and the pain was better. So, yeah, there we go. Thanks, Rosalina. Thanks for the questions. My nipples have looked purple since my breast lift. Is this normal? Now, I looked at this question and I immediately went to see who asked the question because I have a spreadsheet here with all the people who've asked the questions, and it doesn't say. So, no, that's not normal. So if that is my patient, I need to see you or send us a photo. That is not normal. So one of the problems or one of the risks with breast lift is the vascularity, the blood supply of the nipple can be compromised, which means that if it doesn't get enough blood, then it can go purple and you can actually lose a nipple. Nipple necrosis is a risk of breast lift. Now, it's very rare, but it's out there. And so you have to be aware of it. And it's more related to breast reductions, particularly big breast reductions, but it is a thing. So you have to be careful. So it might be that they're just a bit purpley, a bit battered and bruised, a bit knocked about, and going to be fine. Or it might be that they're in trouble. So that is a question which you don't really like seeing at your on your Facebook Live, because you're thinking, hold on a minute, I need to see. Well, if it's my patient, I need to see this person. And if it's not my patient, whoever you are, you need to go and see your doctor and send them a photo at least and get an opinion as to, what you mean by purple. Because if it's just looking a bit knocked about and a bit bruised and a bit pinky purple, that's okay. But if it looks a bit sort of darky, blacky purple, then that's not great, because that is a risk. So, yeah, not a great one. But, seek help, whoever that is. What have we got here? How long post-birth do you have to wait for a mummy makeover? Danny, I've got that question here because you asked on the thing, didn't you, Danny? On the little thing. I've made a note of that. I made a note. So thank you, Danny. So how long, I've got it on here. How long after birth do you have to wait for a mummy makeover? Minimum is 6 months, Danny, and ideally 1 year for two reasons. One reason is your breasts and your stomach will recover after the stretching and the breastfeeding, etc., and the birth. So that's why it's minimum of 6 months to let your body recover from the birth. And the second thing, and the longer you leave it to recover, the better. But I'll say the minimum 6 months. But I think it's hard to have this surgery. Mummy makeover is quite a big op. And again, we're not doing mummy makeovers at the moment because of the COVID, because that's a joint procedure. But anyway, it's hard to recover from a mummy makeover with a 6-month-old baby. So I think it's a little bit easier when the child's a year, if they're walking, a bit more manageable maybe. So I think that those two reasons, letting your body recover and let your child get a bit more mobile, a year would be where I would be on that one. Danny, also, Danny's back in. How many sizes smaller can you go with reduction? Sorry for all the questions. Sorry for all the questions. Whoa, come on. We love it. We love the questions. So how many sizes smaller can you go with a reduction? Well, basically, Danny, the bigger you are, the more you can go down, if that makes sense. So if I say 2 or 3 cup sizes, that doesn't mean if you're a D, you can go to an A. Does that make sense? But if you're a JJ, you can go to a what's a few less than that. Anyway, I don't know is the answer. Broadly speaking, you know, when you talk cup sizes, you talk 150 cc's or 150 grams is a cup size, and you can take, you know, 1.5 kilos off a breast. So is that 10 cup sizes? Can you take 10? I don't know how it works. I don't know how it works. So you can take a lot off a breast, basically. You can take a kilo or more off a breast, but we don't tend to, once we get to that stage of the very big breasts, we don't, you know, the cup sizes pale into, become a bit blurred. So several is the answer, and the bigger they are, the more you can take off. Let's answer the question. Sabotage. I've seen B and A, that's before and after. I'm guessing pictures from a few surgeons whereby the nipple post-op shape looks quite slanted / jagged instead of round. How is this avoided, or how can you make sure the nipple is circular? Really good question, Sabotage. And I'm assuming this is caused by the skin stretch when stitching back together. Now, the problem with Sabotage, this comes back to the question earlier where the patient wanted to make sure they got a good result. You cannot guarantee stuff like this, and it's really frustrating as a surgeon, because what I want to do is I want to make sure that everything is perfect for you, and I want to make sure that the nipple is a perfect circle and everything's brilliant. And we've got things when we do the surgery to make a circular, you know, a nipple marker, a nipple ring, make a circle, cut a perfect circle, make everything absolutely perfect. And then you look at it 6 weeks later and it's an oblong and it's not a circle and it's not quite round and all that. Now, the first thing I say is nipples are never circular anyway. Natural nipples aren't circular. So, you know, that's good because it's natural. And secondly, you just cannot predict how the skin's going to heal and how the scar is going to settle. So you can make it a perfect circle, but then the scar will always settle, and it never is, basically. So I don't. So in answer to your question, how can this be avoided? I don't know. And if you and make sure the nipple is circular. And Sabotage, if you find out, please let me know, because I would love to know how you can make sure the nipple ends up round. Now, I'm not saying it's like really way off. It's always sort of round, but it's never perfectly round, just because of the way the body heals. So what we got here, Rebecca, is a breast lift and reduction different? If so, is there a difference in cost? Thanks. There is a difference in cost, Rebecca, but they're not that much difference, to be honest with you. A reduction and a lift are very similar surgeries, and certainly the markings that we use are very similar. And basically, a reduction is for someone who wants their breast to be smaller and lifted, whereas a lift is someone who just wants their breast to be lifted. So if it's just the shape you don't like and you're happy with the size, then it may be that a lift is what you want. But if they're too big, then it may be that a reduction is what you want. So they're very similar operations, and the only difference is that with a lift, we just remove skin, and with a reduction, we remove skin and breast tissue. And therefore, a reduction is a bigger operation. You're isolating the nipple more because you're removing tissue from around the nipple. You're often removing more skin, so there's more of a lift involved. So there's more scarring. So there's often more scarring with a reduction. So the horizontal scar is often longer than it might be with a lift. Not always, but often. And we send away the tissue for histology, so there's costs involved in that. There's more risks the risks are the same in terms of wound healing and nipple sensation and all problems with the nipple, etc. But they're more a risk with a reduction. So everything's more with a reduction, more potential scarring, more risks, and more costs. So yes, reduction is more expensive than a lift for those reasons. Good question. Thank you. Can you have a flu jab 4 weeks post-op? Hi, Rosie. How you doing? Good to see you here tonight. Yeah. Yeah, that's fine, Rosie. Absolutely fine. Yeah, go for it. Yeah. Hey, have you started doing GA procedures again? XZDS5. Yes, I have. But we're keeping it simple. So we're trying not to do bigger procedures. We're trying not to do joint procedures, as in breast and tummy. We're trying not to do anything on anyone who's anything more than an ASA1. ASA1 being a healthy person with no medical problems. So we're trying to just keep it within that parameter. And that brings me on to this question here. Are you currently operating on type 1 diabetes patients? And dubious type 1 diabetes, maybe. I've got to be honest. And the other thing I would say, actually, and I probably should have said this earlier, everything I say is based on where we are as of now, as of today. Things could get worse tomorrow. Things could get better tomorrow. Let's be positive. But, things change on a regular basis. But as of today, that would be on a case-by-case basis, whether we did a surgery on a type 1 diabetes. Depends on the surgery. So if it's a smaller operation, if it's a minor procedure, mole or something like that, yeah, that'd be fine. The thing about diabetes is you have got an increased risk of infection. That's the problem with diabetes. If it's a bigger operation, we might think twice. Let me put it like that. We might think twice, especially as we stand right here and now, because we stand in a fairly grim situation in terms of the availability and the terms of the capacity of the NHS. It's fairly dire, to be honest with you. So we certainly don't want to put any pressure on that, and we are trying to avoid anyone that has anything. So type 1 diabetes would probably push you into an ASA2, you see. So you wouldn't be that ASA1 grade, which has got no medical problems. So yeah, that would be a question there to be asked. Would you get a better result if you had lipo around the hips and inner thighs with a tummy tuck procedure? Did I have that last week? Anyway, would you get a better result? Yeah, around the hips. Yes, I did have this. I remember answering this question. Hips, yes. Inner thighs wouldn't have no effect. Well, the reason the hips, yes, is because with the tummy tuck, it's quite nice to contour the sides sometimes, and so so doing a bit of lipo to the hips can be nice to contour the whole sides. The thighs seems to be a different sort of cosmetic area, so you can combine lipo to the thighs. If you are going to do lipo to the thighs, I would say lipo to the outer thighs. The inner thighs doesn't respond quite as well to lipo than the outer thighs, so I'm not a big fan of doing lipo to the inner thighs. So yes, hips, inner thighs less so. Rebecca says thank you. Rosie said thank you, doing well. Good to hear, Rosie. Good to hear. Why is my tattoo not suitable for excision photo? So here we have a tattoo. Can we do that? Oh, look at that background. What's that? What is that? Sorry, Instagram. I've got a background on Facebook of trees. And how do I change that background? I never realised I had a background. How do I change that back? Anyway, now is not the time. That is not the time, Kitter. Background there, yeah. Here we go. Change the background, apply. Oh, is that better? Anyway, sorry. Right, stop messing with the background, man. Okay, they're none background. Is that better? None. So this tattoo is not suitable. Correct. Why is my tattoo? So Instagram, I'll describe it to you. It's a rose between the breasts, in sort of like the cleavage area between the breasts, and it's sort of quite wide here, and then it narrows to a short stem. So there are aspects of the tattoo which are favourable in that the shape, it is long and thin because it's a rose, which is good. So that is a good thing. So round tattoos are bad. Long and thin tattoos are good because then we can potentially cut them out. Because the way that I do tattoo removal is by excision. I cut them out. The reason this one is not suitable is because of the location. It's in the cleavage area, and the cleavage area is a very obviously cosmetically sensitive area. So it would leave a nasty scar, number one. There's a huge risk of a bad scar in terms of keloid scar. Very high risk of keloid scar in that area, which would be very unsightly. And secondly, it is quite wide, actually, even though it's not that wide, but it is quite wide. The problem is that this patient here on the photo has got quite a narrow cleavage. You'll have to see without a bra on. I don't know if there's a bra on there, but have to see without a bra. And but it looks like the breasts are relatively close together. So if you remove that skin between the breasts and you bring the breasts next to each other, then you would potentially create what's called a gynecomastia, where the breast sort of merges into one. Uniboob, I don't know if you've ever heard of this. You ever heard of that? Uniboob, gynecomastia, sort of a web between the breasts. And it's often caused, well, not often caused, but it's a risk after breast augmentation if the implants are too wide and the pockets sort of merge into each other. And it's a really hard problem to fix. And I would worry that you could potentially cause gynecomastia by taking this tattoo off, by obliterating that very nice, crisp cleavage that's a very important landmark on the breast, where the sort of medial aspect of the breast is. So that tattoo, sadly, is not suitable for excision, I'm sorry to say. Back in the room. Can you explain what nipple grafting means, please? Yes. So nipple grafting means taking the nipple off and putting the nipple back on again. So it's what I think a lot of people think that's how you do a breast lift and a breast reduction, but it's not. It's quite, certainly in my hands, it's quite a rare technique. So with a breast lift and a breast reduction, you're moving the nipple. The nipple's at a low place and you're moving it to a high place. And a nipple graft means you take the nipple off, literally, you put it on the table, you wrap it in a warm swab, you do the surgery, and then you prepare a bed and you put it back as a skin graft, just like if you had a burn and putting a skin graft on. So you can put the nipple wherever you want. And it's really for people with a massive breast reduction who would have a very long pedicle, a very long stalk of their nipple otherwise. Because what I do is I tend, for pretty much all the lifts and vast majority of reductions, I would keep the nipple attached. So I would cut a circle, as I say, perfect circle, as I say, and then take all the skin around it and take some tissue around it, but keep a stalk of tissue attached. And that stalk will keep the blood supply and nerve supply going to the nipple. That's called a pedicle. And that will give a better blood and nerve supply to the nipple than a nipple graft. And it would only really be a really big reduction when you do a nipple graft. The problem with a nipple graft is you lose projection of the nipple. You always lose sensation. And now you could argue you lose sensation with a big breast reduction anyway, but at least you've got a chance of having sensation. And you can lose pigment, so you can get depigmentation of the sort of lighter patches in the nipple. So it's not without its problems, but certainly for a massive breast reduction, it's got a place, but it's not quite as common as I think people would perhaps potentially think. How long does it take for liposwelling to settle down completely? So this is, I know who this is. This is someone who's had a tummy tuck with liposuction. So it starts, I would say, around 3 months, which is quite a long time. It starts, and I think you get an idea where you're going to be, what you're going to look like at around 3 months. Completely, I would say minimum 6 months, but maybe 12 months, maybe even longer than that, maybe even a year. Everyone's different. That's the problem. Everyone's different. And a lot of people say I'm wishy-washy, but the problem is sometimes it's hard to give clear answers to these questions. It is different in everybody, and some people at 6 months fantastic, looks great, no problem. Some people still a bit swollen, scars quite red, and think, oh god, it's not quite there yet. A year, I would say the majority are there at a year, but still you can have still some improvements even going on after that. So it can, 3 months starts, 6 months you're doing well if you've all completed it at 6 months. Same with the sensation and everything, and the scar and all that. It's all the same. It does take a while for it all to properly settle. After breast augmentation surgery, approximately, when is it okay to bring in exercise? So 2 weeks, approximately. 2 weeks. So straight away you can do walking and stuff, but 2 weeks. But then I would say to you, leave off your upper body. So do lower body, walking, cross trainer with your legs, exercise bike, but not running because of the impact, and not upper body stuff, not gym. I would say you want to leave it at least a month for the upper body. And then at a month, listen to your body. If it's all settled down, if it's not swollen, you can start to maybe do a bit of upper body start or running and things. And if it hurts, then back off. But if it's okay, then that's okay. So, about a month, let's start doing that. Is there a risk of capsular contracture depending on the size of the breast implant? Good question. And I'm going to say easy answer, no, because capsular contracture is scar tissue forming around the implant. So it doesn't really matter if it's a tiny little implant or it's a massive, great big implant. So the scar tissue is going to form around the implant. But having thought about that, the thing about capsular contracture is measured by how much you can see or feel the implant. So therefore, your bigger implant is going to be more likely to see or feel it. So in the same person, if the person's considering having a small implant or a big implant, the bigger implant is going to have less tissue covering it, because the same you've got the same amount of tissue covering it. So in the same person, if they're considering having a bigger implant, you're more likely to feel the edges of that implant if it's bigger. And therefore, if it does develop capsular contracture and go hard, it's going to come quicker with a bigger implant. Does that make sense? So not necessarily a bigger implant is worse than a smaller implant, because what you try and do is make the implant in proportion to the frame and have enough cover over it, whoever you are. So a smaller person would maybe have a smaller implant than a bigger person, which would give the same result, and their risk of capsular contracture will be the same. But in the same person, have I overcomplicated this question? I think I should have just stuck with no. Maybe I should have stuck with no at the beginning. Anyway, perhaps we can edit that out. But anyway, no, not in itself, but in the same person, if you're pushing the boundaries of the size of the implant and you're making it more likely to feel, then when it does develop capsular contracture, you're going to feel that quicker. Oh, that went better in my head than I think it did when coming out. Oh, watch the playback on that one. I don't want my mole fully excised. Can I get it reduced? What the heck? Who's this? Wow. It's a bit of an odd question, isn't it? I'm trying to picture that. I'm trying to think of the situation for that. Well, I guess so. Yeah. If you want to get it reduced, yeah. I mean, you can do a partial excision of a mole. I preface that with, if there's any worry that it might be a skin cancer, then no. If there's any worry that it might be a skin cancer, we need to biopsy it and biopsy the whole mole. But certainly people who have large moles, large nevi, so people have giant nevi, you can take them off in pieces, in bits. So it is not, there is a precedent to take part of a mole up. These really huge ones. I don't really know what the context of this is. I don't know who this person is or why they'd only want part of it excised. Maybe it's a large one in the scalp or something, and there's a bit visible here and there's more in the scalp. That might be a sort of, and they just want the bit that's visible. Maybe that's the sort of thing. that would work. But yeah, in principle, yeah. I had polyurethane implants for a few years. I haven't got any pain, but I can feel it like a ridge lump. Could this just be the implant? Yes. And this is often the problem with polyurethane implants. And you can usually, not usually, but you can often feel it early on. Now, I usually tell people it takes about a year for it to settle. So this patient's saying she's had them in for a few years and she can still feel it. So that is a potential, but usually it's scar tissue growing into it, and the scar tissue then softens over time. So the answer is yes, it could be the implant, because it is a thing with polyurethane implants. Sometimes you can feel a ridge, but as I say, usually settles. So what I would say in answer to that question is, anytime anyone has a lump or a problem like that, they immediately think it's the implant and saying, is it this and this? Get it checked out. Come and see me. Let me examine you. Because I think this is my patient. Let me examine you. Let me see what's what, just to check it's the implant. Because I don't want to be saying to you, yeah, it's the implant. Don't worry about it. And you've got a breast lump. So you've got to remember there's a breast there. So we've got to make sure that it's not a breast lump. So, I would need to see what's going on there. But yes, there is a chance it could just be the ridge of the implant that can sometimes be the culprit. But with any breast lump, you need to get it checked out. So please come to the clinic. Wow, I mean, that was a good one. Claudio is here. I've had some cracking questions. I'm out of questions there, but I got to be honest. Do you like my on-air sign? I got that for Christmas. Yeah, didn't know where to put it. I wanted to put it on the wall, but I wanted my followers. I think my followers deserved it, but Instagram can't really see it. You can see if I do that. Yeah, on air. In fact, is it the wrong way around on Instagram? It's the wrong way around on my screen. It's the right way around on Facebook, but it looks the wrong way around. But we were going to put it outside the room, but I thought, no, my followers deserve that. Yeah, that's for you guys. Yeah, you people. Yeah, smash that like button. Click subscribe. You do that on YouTube. Well, this is going on YouTube, so smash the like button on YouTube and click subscribe. And if you haven't got onto my YouTube channel, I've got 1,000. Yeah, you heard me right. 1,000 followers or subscribers or whatever it is on YouTube. Yeah, so that's what you're looking at here. YouTuber and all this other stuff. Unbelievable. Beard matching the jumper. We've got it all going on here. Right. Well, I'm clearly a very busy man. So I will leave. What time is it? 19:58. So I should be able to get the second Antiques Road trip in. If there's no questions, obviously, if there's questions, well, if there's questions, post them on the messages. Message me, direct message and all that sort of stuff. I'd love to hear from you. And I am going to be back next week, same time, same place. Megan Arnott's joined. Same time, same place. Jackie, what are you still doing here? Honestly, go and get into the party. I'm sure there's a party going on in the kitchen. Get in there and, come on, party on. I will be here, same time, same place. And if you have any questions, please do. Thank you, Bex Immons or Bex Simmons. It's probably Beck Simmons, isn't it? Thanks, Beck. Good to see you. And good one for using the hashtag, even though you're not asking a question. That's the sort of thing. People over on Facebook have asked a question and not used the hashtag. Beck Simmons has actually used the hashtag and not even asked a question. That's commitment for you. Okay, that's how we get that hashtag trending. Is that a thing? Hashtag trending? I don't even know what I'm talking about when I talk about hashtag trending. But anyway, I'm going to say it. So good one, Beck Simmons. Nice one, Jackie. Good to see you all. I'm going to check myself out of here. But don't fear, I'll be back 7 p.m. Tuesday next week. And let's hope the world looks like a better place then. And listen, people, you stay safe. And you stay safe. And let's do the right thing. And let's get the vaccine and